Well, earlier I picked up on the issues raised very eloquently by the students with Dr. Simon Williams, who's a senior lecturer in people and organisation at Swansea University. I began by asking what kind of impact the disruption was having on the quality of students' education.
Well, I think so in some senses, yes. I mean, university staff are working as hard, if not harder, than they ever have to try and adapt to this, rapidly changing public health and policy landscape. But of course, it is difficult. It's difficult in part because at this point in time, there's no updated guidance as to when students can come back. And of course, universities, in the absence of this guidance, are planning to take decisions for themselves and to have students return until perhaps February and review the decision before then. But certainly from the perspective of student well-being and stress and mental health, this uncertainty and not knowing whether it'll be safe to come back in February is causing some issues.
And what's your position on that? So should students come back if they can?
Well, my position is much as the same around the debate on schools, where schools are not currently safe. We can say that universities are not currently safe from a public health perspective. Rates in Wales are still high, particularly in the regions where some of the major universities in Wales are based. So having students come back at this point in time is irresponsible and unnecessary. I think the other problem as well is that we can't say with confidence that even by mid-February, university campuses will necessarily be safe. We've got a new, more virulent strain of the virus. So again, until we are confident that rates that are and the percentage of tests coming back positive in these communities are sufficiently low and at a sustained low level, then it's not really safe. Again, the problem is not being able to know when that will be. So my position would be, with the exception of essential courses, for example, medicine and some other healthcare where they do need face-to-face teaching, we should be online only, potentially until the summer, or even for the undergraduate students until next academic year.
It's all very sad, this, isn't it? Because it's not the experience students work so hard for, all those exams they take, A-levels, to end up sitting at the end of a screen.
It is very difficult, and some students most students have adapted remarkably well, and of course are doing the best they can. But it's not ideal in terms of the lack of social support. I mean, research has shown that during the pandemic, the mental health impacts are particularly acute for those in the 18 to 29 age group, and of course the vast majority of students fall within this age range. So whilst they do understandably long for normality, again from a public health perspective, what they need is clarity, and they need to know when it's safe to come back, and currently for the foreseeable it's not at that point.
And what's also distressing for students is they're running up a huge debt for a substandard experience. I mean, what's your view on a reduction in tuition fees and possibly help with rents?
So yeah, on that topic, I mean, do I think that students should receive partial reimbursements? Certainly. I mean, commensurate with the fact that, as you say, they're not receiving the in-person teaching that they expected to have, absolutely. Now, should the universities themselves have to shoulder the cost? That's not the case for the reasons I mentioned. I mean, university staff are working as hard, if not harder than ever before. So again, I think it is incumbent upon government to provide the further financial support to be able to reimburse students in this way until, again, it's safe to reopen campuses properly.
Dr. Simon Williams, thank you very much indeed.